Welcome to Crack the PANRE-LA Code, a must-know webinar for the Tips to Ace This exam. My name's Katie Iverson, and I'm a PA who works here at Hippo Education. And today I'm joined by Chelsey Meachum, who's my PA partner in crime here at Hippo. Welcome to all those watching live or those watching the recording after the event. We hope that this webinar helps answer your questions and ease your anxiety about the PANRE-LA. We are all in this together, all of us trying to pass the PANRE or the PANRE-LA to keep that C in the PAC after our name. We did a webinar in August about the PANRE-LA, which you can find on the YouTube channel, where we talk about some exam specifics and some different topics than we're going to cover today. So feel free to check that out after this. And one last thing before we dive in, we're going to have a Q&A about a half an hour into this webinar after we give you some tips and tricks. So please put any questions that you have into the live chat, and then they'll get to us so we're ready for the Q&A.
So let me introduce myself. My name is Chelsey, and I've been a PA for 12 years. My main clinical background is women's health, which I spent the majority of my career working in. My husband is in the Army. He's in active duty, so we relocate every 2 to 3 years or so, which makes clinical practice very difficult for me. And I also have 2 small children at home, so I don't clinically work right now, but I work part-time at Hippo Education as a senior medical editor. And I work mostly on our PA products like the PANRE-LA Reference Guide, which I will discuss more in depth later. And I just started my first quarter of the PANRE-LA and finished my questions.
I'm glad I got to hand that baton off to you, Chelsey, because I just finished my whole PANRE-LA in December, so it was nice to pass that off. I spent most of my almost 20 years of clinical work in emergency medicine, but for the last 15, I've been in some sort of education part-time, either working at the University of Iowa's PA program at the medical school there. And then for the last 7 years, I've been here at Hippo Education. I'm now a senior director of education here at Hippo. I work alongside Chelsey to oversee mainly all of our PA products. And as I said, I finished my PANRE-LA in December, which was really nice to hit that final submit button and get the email that I passed. And a fun fact that I was Chelsey's faculty advisor when she went to PA school. So we have been together for quite a while, the two of us.
A long time, yes. So Katie, let's get into the nitty-gritty about how to ace this exam, how to read a vignette, and how to gather any available hints within it. So when I take any multiple choice question myself, this is how I kind of approach the question. And, everyone has to figure out their own way. But what I do is I first read the lead-in question, which is the very last question in the little clinical scenario, the actual question. And then I look at my answer options. And so that kind of helps me focus my brain at what are we talking about? Where do I need to go? And then I go back and I read the entire vignette. Doing this kind of helps me, narrow my focus rather than starting broadly. I kind of get to the point and see where I'm at. So after I read my vignette, I pick my answer option, the one that I think is right. And then I go about and do my searching. I go to Google, I go to our PANRE-LA reference guide, or, whatever other resource I want to use. I want to say that it's so important, and Katie will echo this, that it's important to select an answer before you go about doing your search. Because if you go to another screen, you forget about the 5-minute timer, you get lost, you close your window, chaos can happen, your Wi-Fi goes out, whatever. If any of those things happen and you don't make it back in time, whatever you have selected will get submitted as your answer. So select an answer, then go search so you don't get yourself into trouble. Because if you don't click anything and your computer goes down or something, you have a 0% chance of getting it right. So at least kind of give yourself some grace and give yourself an opportunity to get it right. And then also go with your gut. Don't second guess yourself. We went to PA school. You got this.
Chelsey, that's exactly what I do. I probably taught you how to do this with multiple choice exams. I like to give myself credit for teaching you everything you know, even though I know that's exactly not true, but I like to pretend it is. But I've taken the PANCE once, like we all have. I've taken the PANRE now 3 times. And Chelsey and I both have written a lot of questions for Hippo. So we are really good, I think, both of us, at looking at clues within questions. When we write items, we actually are trying to avoid putting clues in for the user so we don't key them into the right question. But when we're taking a test, we actually really want to look for those clues. And just to be honest, everyone knows standardized test is a game. This is a game we have to play to keep certified, and answering a question is like a game. And so a test savvy person can actually sometimes get a question right without even knowing the answer by looking for some clues that are in either the question, the vignette, the actual question, or in the answer choices. And remember too, when you start taking this test, that this is book knowledge. This is not clinical knowledge. You have to take your clinical hat off when you take this. This is the number one complaint that I hear about this exam, whether I'm reading like on a Facebook group about it or people write into Hippo about how frustrating they get because the question isn't what they would do in real life. So you have to remember, like, overarching, this is not real life, this is test life. And we talk about this in our other webinar too, but it's really easy to overthink a question or assume that they mean something that's not there. And you can say, oh, I saw a patient last week and we did X, Y, and Z, but on the exam, the answer for the book is A, B, or C. So you have to really take that clinical hat off and realize that there are going to be some questions that are just frustrating to you because it's not the way that you would do it. But you remember that it's just that kind of the test knowledge. And they don't say it in the question, it's not there. So don't assume they meant it, or that everyone that has this condition also has this. Don't assume anything. If they want you to know it, they will write it in the question. So here are some specific tips that we have that can help us clue in on the answer. So a caveat to all of this webinar: we don't work for NCCPA. We've already said we work for Hippo Education. We don't write questions for them. We're not in any of the rooms where they figure out how to make these tests for us, but we've done enough writing of items and taking of tests to kind of know some of the tricks. One of the biggest things that NCCPA does on the PANRE-LA, which I think is so helpful, is they tell you the organ system before you open the question. This is unique to the PANRE-LA. This is not, it doesn't happen on the PANS, doesn't happen on the traditional PANRE if you take it in the testing center. But before you open the question and start your 5-minute timer, they will say, this is a renal system question. This is a hematologic system question. And so if there are options, if you can't find the right answer and there are options that are not within that system, they're most likely not correct. So if there's 5 options and you don't know, pick the one that's most likely is the renal option, because if it's a renal question. So I've gotten questions correct because I've just picked the option that made the most sense for that organ system. Even if I'm between 2 or 3, or I thought I would do all of these things actually at the same time, I picked the one that's about the organ system they're telling me the question is about, and then I've gotten it right. Now, with all of our tips and tricks, you can send us all the hate mail you want, but don't come at us. Like, there's always exceptions to the rules and exceptions to the tricks. But in general, if it's a hematology question, you're going to give them a hematology answer. And then looking for clues, it's really important to look for grammatical clues in the question. So if they ask the actual question for something that's plural, then the answer will be plural. And again, if it's singular, then the answer will be singular. And the nouns and the verbs should match the tense and should agree with each other. And if they're asking about a medication, what is the most likely medication? The answer is obviously going to be a medication. Sometimes they'll have an answer that is, 2 medicines, 2 lab values, and like a diagnostic imaging study. But you have to actually figure out what they're asking, but look for the kind of the grammatical clues, especially about the plural and singular. That can help you. There's another strategy that we like to call long correct answer. It also goes along with this convergent strategy. So if is there one answer that's longer than the rest, it's most likely correct. So if there's some that are all the same-ish length, and then the one is obviously longer, is most likely the correct answer. This also goes with what's called the convergent strategy, is that if there are options that contain other options, the one with all the options is most likely correct. That can be confusing. So like, if option A is admit to the hospital, it's a fair option. If option B is admit and give IV ceftriaxone, that most likely is the right answer over just admit, because it's admit and do something else. So look for them to converge together and to put more or one of the options together. And the more that are converged, the more likely that's the answer. Also look for word repeat. So if there's any kind of cluing in the question about like a posterior nosebleed, they're going to say posterior perhaps a few times in the question, that there's blood noted in the posterior pharynx, that they see continued bleeding in the posterior oral cavity. And then they're asking you maybe what the treatment is or what the management is, and it's going to be like packing the posterior nose. So look for some word repeats, posterior, medial, lateral, those type of things. A couple last clues that may help you is, one is paired options. If you have 5 answer choices and 2 of them are pair, most likely one of the right answer is one of those pairs. So if nothing else is paired, but two of them are, most likely the right answer is one of those. And by paired, I also can mean like opposite, like lateral collateral ligament or medial collateral ligament, right or left, that type of paired, which is also kind of opposite when it comes to the body. Now, this was this one for my dad, good old Joe Cook. My dad always says, never say anything absolute. My dad will never say never, and he'll never say always. And he probably writes for NCCPA. Just kidding, he doesn't. He's an engineer. But if you see the word always, if you see never, all, none, every, it's never say never, but it's most likely not the right answer, because we know there's really nothing absolute in medicine, and NCCPA does not want to open themselves up for people to argue a question by saying, oh, there was someone in 1755 in Bangladesh that had it this way that I read a paper about. They don't ever want to say always or nothing. So there's really nothing that's 100% all or 100% nothing. So again, these are not universally true, but most likely you'll never have the correct answer, have an absolute term in it. Did you like how I said like 17 things absolute all at the same time, but also said never? So most likely, always, never, every, all are going to be wrong. A lot of times too, the most basic answer is correct. I don't know if you've noticed this, Chelsey, but unless the person's super sick, like if they're super sick and they have hypotension and they have a huge fever and they need to be admitted, like they're really sick. But if it's a regular type patient, most likely the correct answer is the lifestyle modification, or the easiest, most basic choice, unless they've told you specifically that they've already kind of failed conservative therapy. So if it's a question on carpal tunnel management, the answer is most likely night splint over picking the answer that's injection. If it's about varicose veins, it's most likely TED hose over like ablation surgery, unless they've said that they've failed, conservative treatment. And then there's two that are almost universally correct, but not always correct. Securing the airway is most likely always the right answer. And quitting smoking is also most likely always the right answer. There's never really a question that they're going to ask you that quitting smoking is not the correct answer if it's a lifestyle choice, unless, of course, like a septic patient that needs admission to the ICU, then quitting smoking obviously is not the right choice for that patient. But quitting smoking usually is always universally correct, as well as securing the airway, especially in a traumatic patient where there's a bunch of stuff going on. Securing the airway is usually going to be the right one. But again, you never say always and never say never, but those are some of the things that we clue in on to try to find when we look for the right answer.
Definitely. So this whole webinar will be up on YouTube after the fact. So if anybody needs to rewatch things, there will be access again. So if you need to rewatch something, but I wanted to talk about another trick here regarding what to do. If you're reading the question, you need to read the question very closely, because a lot of the exam questions that I've ever taken, there's one word that you need to pay attention to. It's, what is the initial intervention? What is the confirmatory test? What is the definitive diagnosis? So make sure you are answering what they are asking. If you don't want to just get hasty and just go for it. So like Katie said, the initial intervention, well, in clinical practice, we might order the lab, we might order the x-ray, we might put in a consult all at the same time. But the initial one is, keep the patient alive, secure the airway, is what they're asking for, most likely. So just remember to pay attention to exactly what they're asking. And you might have to read the question 2 or 3 times through before, just to verify that you're answering the correct question. Another tip that I have found is that if you have no idea what the disease process they are asking about in the question, look around the vignette. There's probably a specific clue that they have put in there, like perhaps the person is a shipbuilder, or they work in a quarry, or they recently emigrated from another country to the US, or they're not up to date on their vaccines. All of these clues that they put in these questions matter to what they're asking. They aren't just putting that in for fun. So make sure you pay attention to those things. And a tip, if you're clueless, you can always go to Google and say something like, what pulmonary condition can someone get that works in a shipyard? And at least kind of get you back on track. And then you can go about searching more references.
I know the answer to that one. If they're build ships, they have asbestosis. I don't make the rules, but that's what it is. I also realize I get excited when I talk about this, and I know I talk fast. And as Chelsey said, you could rewatch this. and you can slow down a YouTube video so you can understand if I'm talking too fast for you. I'm sorry. There's so many clues that they may give you, not only the clues that we've talked about with the paired options and the grammatical clues, but just also the historical clues. So people like to blame the entire state of Connecticut for Lyme disease. So if you go camping in Connecticut, you're going to get Lyme disease. I don't also know why. They usually don't have other states on tests. And if you go camping in North Carolina, you're going to get Rocky Mountain spotted fever. So those are kind of the ones that I always see, those states. If you by chance leave your leftover grandma's Thanksgiving dinner in the back of your car and or on your counter, you're going to get Clostridium perfringens. Again, I don't make up the rules for these. It's just kind of like the buzzwords that you'll see. So if you're between two questions, between two answers, and you can't figure out between, go back and see if you're missing one of these historical clues. Obviously, someone can be pregnant, which changes whole sorts of things. Check the vitals. I read through them like, oh, that's fine, that's fine. And then I go back, I'm like, oh, wait, that's not fine. Like, that's not actually a fine blood pressure, but my eyes have gone too fast over the vitals, or I miss that they have an allergy to a medicine, or that they're on another medicine that may interact. So if you get down to two different medicines, you're like, you could give both of these to this patient. You're missing something because one of them is going to be contraindicated. So go back and look at their current med list or look at their allergies. And then all else fails, put it into Google. Does X interfere with Y? Can you take these two meds together? Just go through the list, and then Google can quickly pull up which ones interact with each other, because they won't have two correct medicines without giving you a clue that one of them won't be beneficial for that patient. And then I love buzzwords and things, but I also really get jazzed when they ask me about fava beans, because I don't even know what a fava bean is, but I do know that that causes people with G6PD deficiency to get hemolytic anemia. One day I want to see a fava bean in real life and taste it. But those type of things, like, why would an item writer tell you that this person was eating fava beans? They're telling you that because of G6PD. So look at some of those more buzzwords that you can see. And then once you kind of take some of these test questions over and over, you kind of realize like where the clues are coming from and how they're writing them.
I am going to find you fava beans for Christmas, Katie.
Okay. Send them to me and I'll eat them. I'll eat them live on YouTube and we can see what they taste like. And then if I have hemolytic anemia, we'll know that I have G6PD. But at 50, you think I would have figured that out already. So hopefully.
Yes. One final clue, helpful hint that I want to share is that the NCCPA blueprint can be your friend during this exam. So when I take my test, I have the blueprint open next to me, because if I'm totally off track and have no idea what in the world they're even asking me, it can help you find a topic that you forgot about or that your brain didn't even think about, and get you back on track to help you answer your question. So for example, this quarter had an infectious disease question and I was like, what are they talking about? I was so clueless. And so I panicked and I went to my blueprint and I read down the options, all this stuff. And then when I read the one, my brain like clicked and I was like, oh yeah, that's what they have. And so it just helped me kind of like stop panicking, because I was like, oh my God, the timer's ticking down. But it helped me get on track, and then I could go about my search and find my way back. So all else fails, look at your options. Hopefully it's in there for you. So now the next part of this webinar, we're going to move into our PANRE-LA reference guide kind of tutorial for everyone. Hippo Education has a product called the AAPA PANRE-LA Reference Guide, and it's an online searchable guide that has over 700 pages of content. It has images, tables, EKGs, x-rays, all sorts of things to help you while you're taking your PANRE-LA questions. When NCCPA came out with this new testing option, Katie and I spent many hours talking about the best and most helpful way to make a resource for our users to help during your questions. So we came up with this searchable online version, and we used the NCCPA blueprint directly to make our reference guide. Exactly how they have it laid out is how we have it laid out. Even in the one place that NCCPA misalphabetized something, we followed. So it's the same as the blueprint. So we didn't do that on accident. After I finish, I'm going to share my screen and give you a little tutorial, highlight some of our content that's helpful, some of our important functionality that can help you be successful when you're taking your questions. The reference guide is available for purchase on our website for 1 year, 2-year, or 3-year subscriptions. And it also comes with 18.75 hours of Category 1 CME. And we will put a link in the chat if you are interested in checking it out further after this webinar. So I will share my screen. All right, can everybody see that? Perfect. So this is our PANRE-LA reference guide. I'm going to move this. Perfect. There's 2 ways to kind of navigate around here. So you can see here there's 724 pages of content. There is a main table of contents down on page 2, and it walks you through all of the different organ systems. And all of these links are clickable. They're embedded links. So if you click on this, it'll take you to page 4. If you click on this, it'll take you to page 134. So this is how you can navigate around. Alternatively, on the left-hand side, there is another way to get around. So you can use this sidebar to get around as well. So when you open your question and they say that it's an endocrine question, you can either click this and it will take you here, or on that main table of contents. And this is also the NCCPA blueprint content topics listed in order. So I get my question, I open it up, I say, okay, endocrine, and I just breeze through these real quick, just look at all the options, and then I open my question. So you can use this, these are all clickable, or on the sidebar, you can browse through those and they're clickable as well. On the sidebar, everywhere that there's one of these little caret things, it's a drop-down menu. So it expands further. So make sure every time you see this, you can open it wider, and then to collapse it all, you just click them all again. So that's how I use it. I open the organ system, go about browsing. If you're like, I don't even remember anything about this, take some time before you open your question, familiarize yourself with it. But once you start your question and select your answer before you go about your searching, you select your answer and then say you're like, oh, I think this is a question about osteoporosis. You can go in and read, if it's a risk factor question, we have risk factors in some of our sections, signs and symptoms, diagnosis, treatment, complications, all of our sections for topics, we try to be as comprehensive as we can. So that is what I do. And then obviously if we, don't have it or it's not helpful for a certain thing, Google or some other resources can be your friend as well. The other option that we have, and it's very, very helpful, is this search function. So you can, if there's a buzzword that they put in, like we talked about earlier, shipbuilder or something, you can click on this search function and type in your phrase. So say you get a question about the patient having gingival hyperplasia. You type it in, hit enter, and it will search our whole guide for how many places we have gingival hyperplasia, and it highlights it over here. So calcium channel blockers have a side effect of gingival hyperplasia, and you can use these up and down arrows to toggle through the options. Phenytoin has a side effect of gingival hyperplasia. Again, phenytoin, and then our fourth option is, again, phenytoin has a gingival hyperplasia side effect. So I'm assuming if you get a question about gingival hyperplasia, it's about what medication is this patient on, and we can help you get there. The biggest thing about our search function is it is a key word search, not a key phrase, not a phrase search. It's not Google. So don't type in like 5 to 10 words, because it is exactly how you type it is how you're looking for matches in that match word for word. So for example, if you type in rheumatoid arthritis /RA, we don't have it like that. So just try to if you're not finding results, if you get 0 results here, you just need to change what you're asking it, and try to limit it to like 1 word or 2 words at the most. So another thing to pay attention to is spelling. Like I said, we follow the NCCPA blueprint exactly. So if you don't know how to spell it, look there quick. But another thing to try is if you're just not sure how to spell something, if you have a question and they say something about lactate dehydrogenase. Like obviously they probably told you that and you know how to spell it, but if you don't know, just do the first couple of letters and hit enter, and it can get you there. So you just have to play around a little bit on your search function to know its capabilities. Another thing that I want to highlight is the disorders that have apostrophe S to them. So for example, Down syndrome. Is it Down? Is it Downs? Who knows? Exactly. It goes both ways in medical literature sometimes, but if you type Downs syndrome or just Downs, we don't have any matches. So if you back it up to Down syndrome, we have 5 options. So again, it's how it's spelled out on the blueprint, but when in doubt, leave off the apostrophe S. Also like Crohn's, we don't have it as Crohn's, we have it as Crohn disease. So just some tips and tricks there as to less is more in this search function for sure. And finally, make sure you hit enter. Katie and I have done it a million times where we're like, why don't we have anything? I know we put this in here. What in the world? Hit enter, my friends. It's like Google. You have to enter to make it do anything for you.
I've gotten so mad at myself, even though you and I wrote it in the middle of the PANRE-LA taking it because I can't find it. And I know it's in there because I wrote it in there. And then I was like, oh, dummy, hit enter. Just hit enter and you'll find it.
Totally. So some other things that we have besides just the organ systems and the content topics like the blueprints, we have pharmacology tables, which we added. And obviously we thought that they would be helpful for our users during testing. So there's 2 ways to navigate to our pharmacology table. Like I showed you before, you can go to the system topic list. And if you scroll all the way to the bottom of like the cardiovascular organ system main table of contents, down here we have bonus content and we have a pharmacology table. So again, this is clickable. It will take you there. Or on the sidebar, if you scroll all the way down to the bottom, before you get to the next organ system, this is where we have our bonus content housed. So you can click there and it takes you to our pharmacology essentials. You can play with this zoom feature to see less or see more. But we have pharmacology tables for almost all of our organ systems. Not all, like we don't have one for dermatology. But inside the table, we have listed what we cover in the table. So hypertension, heart failure meds, yada, yada. And if you go down, you can see that we have drug classes and drug names. We don't have an exhaustive list of drug names because that's too many to include, and this would be very, very long. But we try to just cover like the main ones. We cover the mechanism of action, the indications, side effects, contraindications or cautions, if there are any, and any special considerations. So pharmacology tables are where you need to look if you get asked a question specifically about a certain drug name, because up above in our main sections, our blueprint sections of this certain topic, in the treatment section, we don't often include very specific things about, treatment is with this medicine. We kind of leave it to drug classes, ACEs, ARBs, beta blocker, nitrates, and stuff. So if you get a question on a certain medication and you have no idea what drug class that is, just go to Google and say, what drug class is this medicine in, and then come back to our pharmacology table, to the actual drug class section, and hopefully it can help you get the answer that you're looking for. We have other bonus content that I will highlight for you. So the pharmacology tables and the bonus content, they don't necessarily fit anywhere in particular on the blueprint, but it's all stuff that we thought was helpful for our users and very important to know and possibly could be helpful during your test. So let me get to one of those. For example, in the pulmonary section, pulmonary system, our bonus material, we have a section on pulmonary function tests. So you might get asked a question about that. We have some information for you here. In the renal system, our bonus content, we have an acid-base primer and review. So if you get a question about acidosis, alkalosis, all that stuff that makes us want to vomit, we have stuff that you can, either beef up your knowledge before you take your test, or if you just need help during, you can look here. And then in our neurology section, these are just some of the ones we have. In our neurology section, our bonus content is a cranial nerve review and a visual field loss and lesions. So if you get a question on any of the cranial nerves and you're like, I don't remember the name of that, which nerve that is, here you go. And then I forgot to mention our pharmacology, or our pharmacology table for infectious disease. So this one is very important because infectious disease meds, antibiotics, antivirals, antifungals, all that stuff can be asked about in any of the organ systems. So we decided to put it in the infectious disease section. So remember, if you get a question, to come back to the infectious disease pharmacology table. If you get asked a question about, a certain penicillin, cephalosporin, macrolides, it's all here. You just need to know where to look. So that's why I'm telling you, it's here. Like I showed you before, we have a zoom function. So if you are looking at an EKG in our reference guide and you're like, wow, I can't really see that, you can zoom in by clicking that plus sign or out. Alternatively, if you right click on the image, you can enlarge it in a new tab and you can see it better. So that is one way to use our zoom function. And then finally, there is an emergent topic section that we added also to be in line with the blueprint as well. So on the blueprint, all it says is legal, ethical, and DEI, which stands for diversity, equity, and inclusion. So Katie and I made a stab at what could be included. And so we have some topics for you to either review again before you take your test, or hopefully we can help you during your test in there. Katie, do you think there's anything else that we should show them?
No, that was really great. I think the biggest thing is just how to search and to navigate around and to know where the pieces are, but also, and then show them that feedback button on that bottom left corner. If you have feedback, if you find a typo, if you find an arrow that you think should be down arrow and I have an up arrow or something, please send us feedback. This goes right to Chelsey and I, and you can review it. We fix the guide when we find errors or typos, and put a new guide and, replace the guide all the time as we're updating it. So please send us some feedback.
Yes.
A lot of people will ask us, how to prepare for the test. Should I do something before? Should I get ready for the test? And so there are obviously a million different ways to prepare for this exam. But if you're going to, no matter what resource you use, if it's our guide, or if it's something else, spend some time knowing where things are in the guide or in your resource and how to get around before you start the test. Take that anxiety off your shoulders. There's a lot of bonus content in our guide that don't actually fit, again, like the acid base. PFTs can fit in lots of different pulmonary things. We just put them at the bottom. There's a bunch of musculoskeletal because they have very vague terms on the PANRE blueprint, like soft tissue injuries or tendonitis. They have kind of vaguish terms of like all the things in your musculoskeletal system that could get hurt. So we have lots of things in a bonus content, especially also for MSK, that like they're going to ask about this. I'm sure they will, and we're going to put it in, even though I can't actually neatly put it into one of the topics they have. So make sure that you go around whatever resource you're going to use and know how to navigate it in a quick, timely manner. And also NCCPA puts out a really great tutorial video about the actual test. So I like to know what I'm getting myself into because I get test anxiety. So it shows you like, here's what the screen's going to look like. And here's what it means when we're going to tell you the organ system. And then here's how you click to open the question and start the timer. And there's the timer on the top right. And then there's where the normal lab values are. And there's how you can open an image to make it bigger on their test. So spend some time doing their tutorial. It's like 8 minutes or something, just looking at it before you open. So you kind of navigate around their site. And then if you're going to use our guide, I recommend you kind of navigate around our site so you're familiar with it.
Definitely. I agree. Just kind of, take a little tour, click around, see what we offer, because in the 5 minutes, they go fast. You don't want to be learning this guide in those 5 minutes. So that's our tip. That covers our little overview of our reference guide. Again, check out the link in the chat if you want to see our pricing options on our website for our different subscription lengths. And then always please reach out to someone at Hippo if you have any questions. Our support team is awesome. If you need anything with your reference guide subscription or anything, we are all here to help you.
Yeah. Okay, let's answer some questions, Chelsey. I will read the ones that we've gotten in so far. Okay, this is a can of worms, and we're going to open it. What is the pass rate for each quarter? Okay, nobody knows. This test is a mystery of how it gets graded. So it is because they have all these psychometricians that are figuring out like how good the question is. And some questions I'm sure are beta questions and which questions are actually going to count. So there is no way to actually know what the pass rate is. And there's a lot of information on the NCCPA website about this, and we have a few blog posts that we can link to. I don't want to confuse anybody, but every quarter you're going to have questions that get replaced or removed. So a removed question is completely taken out because they determined 6 weeks, 6 months, 8 months later, there's a bad question. So enough people got it wrong, enough people argued about it, or they realized the question was, kookadooks or something. So they remove it. So you will see in your score guide, sometimes we'll say removed question, totally gone. You can't even look at it to review it again. It's just disappeared. Then there are replace questions. So if you get a topic wrong in your first quarter, say you get a question wrong about shoulder tendonitis, they're going to ask you a tendonitis question down the road, most likely in the next quarter on shoulder tendonitis, not any, that's what they're going to ask you on. If you get it right the second time, they take away that first wrong answer and it gets replaced. So when I did all 8 quarters, in my first quarter, I had so many that got replaced and removed that probably less than half were actually scored because I got different ones asked. And if you don't get more than 5 wrong a quarter, they're still going to ask you 5 repeat topics. Now, this is where it gets confusing because no one quite knows why. If I got 25 out of 25 right in a quarter, they're still going to ask me 5 repeat topics. And then they're going to replace 5 correct answers from my first quarter with hopefully 5 correct answers in my second quarter. NCCPA says they are never going to replace a correct answer with an incorrect answer. But I had dozens of correct answers replaced by future correct answers. So when it came down to the very end of the test, and I averaged 2 to 5-ish wrong a quarter. Some quarters I got them all right, but I usually got a few wrong. At the very end of my whole exam, it told me the questions that I got wrong, and I got 5 topics wrong out of all the questions I took because they kept replacing and asking me again if I got it actually wrong, and then it counted. So there is no way to know what the pass rate is. When you get your score sheet, now, if you're in your very first quarter, the scores are not up yet. They come at the very end of the quarter. But if you're in your 4th quarter or your 9th quarter, your 5th quarter, or 9th, you know this. You get a score report on the site. It has your score, purple bar. It's out of 1,500. It has minimum passing score, green bar. Always is set the same. It has average score, gray bar. All you have to do is keep your purple bar longer than the minimum passing, which is the green bar. And I've gotten some people in the first quarter, the very first quarter, I know some people that got 25 out of 25, but their score was not a 1,500, but they got them all right because they must be weighted different, or I don't know how they do the grading. So you can spend all the time in the world like trying to get a PhD in how NCCPA grades this exam, but it'll make you crazy. So just try to keep that purple bar longer than the green bar and you'll be totally fine. But realize that if you have a bad quarter, questions are going to come back at you. And then if you get them right, they're going to replace them.
Definitely.
Yeah.
So
okay, someone else said, oh, sorry, Chelsey, what?
You want me to take one?
Oh, yeah.
So another question is, if I buy the 3-year subscription, do I still get the updated guide each year if you make updates? So we make updates constantly on this thing. So it's not like you get the content when you hit purchase. It's always, 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 always. So let me share my screen again and I can show you what I mean.
This is the reason too why this is not downloadable, is because if you download the guide today and we update it in a month or two, then you won't have the most updated information. And that's why we keep it live on the site, but Chelsey will show you where you can tell what the version is.
So when you open your subscription and come to this main page, page number 1, we have right here when it was last revised. So we just revised it. We revise it every quarter, definitely, if not every month, if not every week. Like, we are always in here tweaking it, fixing it. So when you log on, you'll get the updated content. So it's not like you're going to be outdated in 2 years if you bought the 2-year subscription. So don't even worry about that.
Yeah. Okay, someone asked, shipbuilder does not seem to be searchable. Okay, so we got ahead of ourselves when we talked about shipbuilders because asbestosis is actually not on the PANRE-LA blueprint. We got all excited about a buzzword that we could talk about, but asbestosis is not covered in the pulmonary section, so we don't talk about that in the guide because it's not one of the cover topics. So sorry for everyone that builds ships. You're most likely not going to get asked about on the test. But for the terms to be searched in the guide, just do a word or two. So gingival hyperplasia, bleeding gums, abnormal reflexes, like try to see what the couple words you can put in to see if you can find where it may be in the guide. I find the search function really helpful for medications and also like for side effects of looking for something specific. Someone else asked, does the 2-year subscription make the most sense if we're in your first quarter of testing? So it most likely does make the most sense because hopefully you'll just go straight 8 and not have to do the last 3rd year. But if something comes up, if you buy a 2-year subscription and something comes up, you have a huge life change, you have a cross-country move, you have an unfortunate, medical issue in the family, and you skip a quarter or 2, you can always re-up and get that 3rd year and just call our support team and they can help you renew, like to extend your subscription for that 3rd year if you need it. But hopefully most of us were just going to get done in 8 and just go through 8 quarters. 8 is great. Maybe that can be our new slogan.
It's great. Perfect. We already talked about the color bar function. What else should we do? Oh, so the repeat. Did you cover repeats in the last?
I did. And again, it's hard to know whether or not the repeat is going to be in the next quarter. So like if you get shoulder tendonitis wrong this quarter, whether or not you're going to get it next quarter, my gut from what I remember is it usually is right the next quarter. So that's another way to use our guide once you're done with the test, because 5 topics are going to come back. So if you've gotten 3 wrong, 2 wrong, 4 wrong, 5 wrong, 7 wrong, studying those or at least reading up a little bit about all of those wrong topics before you open the next quarter will be helpful because they're coming back. And I can't 100% say that you get them the subsequent quarter, but from my memory of taking it is that if I got something wrong one quarter, I saw it the next quarter. But again, I don't exactly remember all the specifics if it was 2 quarters later, but what's coming back at you.
Also, for those who haven't taken any of their questions, what happens is you find out your organ system, you decide if you're gonna take it or store it. You can store 5 questions at a time. But after you take your question and you hit submit, another screen will pop up that says 3 questions. How confident were you in your answer? How applicable is this to your clinical job or something? And did you use a resource? So there's some algorithm that they use at NCCPA that my guess is if you hit low confidence in your in how confident you were in your answer, that you'll get those back, even if you get it right, because low confidence may mean that you just guessed. So that's also a game, perhaps. I hit high confidence on all of them because I was like, I don't want to give you an open door to ask me this again. I don't know if that's right, but we'll see.
At the first couple quarters, I monkeyed around with high, medium, low to C, but then I couldn't remember what I did. And I was like, I care, but I don't care if trying to reverse engineer their algorithms. I'd rather deal with other algorithms, like finding, cool things on Instagram or something. So I didn't spend that much time. But after this 3rd quarter, I gave myself high confidence. I'm like, I'm smart. And then I gave myself, and I said it was low impact in my career because I don't work clinically. So nothing actually matters to me when it comes to patient care because I work for Hippo. So I gave myself high confidence, low relevance, And I always used a resource, but again, I couldn't tell you how that means that things came back to me or not. But there's probably a game there. That is somewhat of a game in terms of how you rate your confidence and what comes back at you, but I don't know if it's actually worth any of us trying to understand. Okay, someone asked, if you get to the 8 quarters and you take 8 quarters, how do you know you're done? You know you're done because that purple bar is longer. And then you get an email saying, congratulations, you passed your PANRE-LA, and then you get shut out of the course. Like for about 24 hours after you finish your 25th question, you can still get in and kind of review and see what you did. But then you'll get an email saying like, you're done, peace out. And then you lose access to that whole kind of dashboard in the system, and it goes into your exam system that, like, you know, it has my like pants from 2000 forever ago, and then my other PANREs, it goes into that. Once you finish 8, you will know when you finish 8 whether you've passed or not, because your purple bar will be longer.
Definitely. But if you didn't take one whole quarter, if you just like forgot, or you were on vacation, or you had a baby or whatever, you have to take all 8 to be able to be done in all 8. So definitely something else to keep in mind. Someone asked about specialty. 2 people asked about being in specialties. So are there any suggestions for those of us in a specialty? I've been in ortho for almost 30 years and find it hard to put on my primary care hat for the test. And someone else also asked about a review course that Hippo offers for people in the specialty. So I am technically, my background is in women's health, OBGYN. That's all I've ever worked in. For the most part, I dabbled in like military medicine for like 9 months, which is a whole different conversation. But I have never been primary care. So I did not find that these questions were overly hard for someone like me that has been in a specialty, because you have access to resources. So, and you know, I work for Hippo and write questions, so I might have a leg up on question taking, but I didn't think that maybe 2 of the 25, I was like, what are we talking about? So I don't know, if you have a lot of anxiety, you can definitely take a course, but the purpose of the PANRE-LA is to not have to take a course and go in person or, you know, do this. But if you do feel overly overwhelmed about it, Hippo Education has a PANCE PANRE review video course that if you just need to, you know, improve yourself on cardio or psych or something, we offer that for users as well.
I think so. A couple things I'll say about that too is, especially so you actually may have a leg up, because if you don't have a primary care hat, then you can't have a primary care frustrated hat. Like you can't be mad that the question's not written right because you would do something else in primary care clinics. So sometimes specialists actually have a leg up than on people that are generalists taking these type of tests, because they just go to the book answer. The book says X and that's the answer. So I think that using either our guide or using another resource will be enough. The problem about studying, and I'm not saying don't buy our course or don't study, but that this thing is 2 years long at least. So if they told us, if NCCPA said Q1 is endocrine and pulmonology, Q2 is psych and derm, Q3 is cardio and hematology, if they told you like what was coming each quarter, then studying would be awesome. Like then watch our videos on the cardiology before your cardiology quarter. But if you study now on January 15th a bunch of cardiology and get super good at it, I mean, I'm not saying you're not a genius, but like by August or October 11th, when your 4th quarter starts, how much are you going to remember? The beauty, in quotes, of the PANRE when we took it in the test centers, we would like jam the stuff in our head for 6 weeks, study, like we were in PA school, just get it all in our head, go to the testing center, blop it all out, be done, go get donuts and coffee on the way home, and hopefully we passed, right? But now, because we're supposed to be longitudinally learning along the way, I don't know if studying today and doing a video review course is going to help you in August, in October, next January, next March. And I also don't know, I don't think people have enough time to study straight for 2 years for this. So I do think that using a good resource is helpful. Now, for people that are out of the testing game, obviously people haven't taken a test for 6 years at least, I do think practicing test questions is helpful. So we have our PAQ bank. We have a lot of test questions in our PAQ bank. We have a 110 question general practice self-assessment that Hippo sells. I do think, and you can get them other places as well, not just from Hippo, but I do think getting in the rhythm of having some standardized test questions under your belt before you start will help your anxiety. So you remember these things that we've talked about, looking for paired answers, looking for noun verb agreement, looking for weird buzzwords like fava beans. I do think if you're in a specialty and you're completely out of general medicine, doing some general medicine practice questions like our general practice self-assessment and just going through 100 questions and getting that back in your system would actually be more helpful, I think, than watching 10 hours of cardiology video, because you may only get 2 cardiology questions your first quarter, and you might get 11 in your fourth quarter. You never know.
I agree. I only got 2 cardiology questions this quarter, actually. But to your point about taking questions, you could also practice using your references too. So do a question on a QBank, use the PANRE-LA reference guide if that's what you want to go with in Google, set yourself a 5-minute timer and just kind of like get in the flow where it doesn't actually count and just see how you feel about it, is another option to do as well. So another question somebody asked is, how does the CME work? Do you get credit for the time spent in the guide? So I can share my screen also again to show you like how to even find the CME, because that's a question we get often. So when you open the reference guide, it's this full screen thing. And on the left-hand side, you can see all of your subscriptions of other Hippo products if you have more than one. But if you click on the CME button here, this is where you'll claim it. And so the question about when do you get it? When you open the PANRE-LA reference guide for the very first time, you get credited for your 18.75 hours, because the hope is that over the 1 year of you having this subscription, you're going to spend about 18 hours digging around here, looking at stuff. What else do you have to say about that, Katie? Any suggestions?
Yeah, no, just remember to just click on the left-hand side. And then if you do have any trouble getting your CME certificate or it's not printing out, you can't find it, email our support team at support@hippoeducation.com, or click that feedback widget and be like, hey, I need help with my CME, and give us your email address and we will contact you about that.
Yeah. And I'll show you how to get rid of this far left-hand side. Because when you log in, you see all of this. You see this panel, and this panel. If you hit this minimize navigation, you can hide that and just hit it again to get back and find the CME. But this gives you more of a full screen version.
Somebody did ask about, do you have to answer all 25 questions at the same time? Nope. You can answer 3, and then you can answer 7, and then you can answer whatever. That's the 15 left. You can answer as you go. I like to do all mine at the same time because I like to get it done. Everyone makes fun of me because I like to do mine like the morning they open, like by noon on the first day, I'm like, I'm done. And I like somehow feel proud of myself, like my mom's going to care, and put it on the fridge. But some people do them at the very end. If you follow one of the PAs that works here named Suzette, is one of our Instagram posters, and she as a PA, and she puts posts up on Instagram like when our quarter is about to end and when our quarter is about to start. So she gives us lots of heads up. You will also get a million emails from NCCPA. So it's like they want to date us. They email us so much. They will send you emails if you haven't done, if you're not finished. Hey, your quarter is about to start. Hey, your quarter is about to start. And then you get an email the day. Hey, your quarter started. And then you'll get more emails if you haven't finished. So they will send you reminders. We also put reminders up on Instagram, but it's really helpful. Like if you in your Google Calendar to put reminders in to make sure you get all 25 done by the last day, but you can do them at any speed that you want.
Yeah, like I have 2 small kids at home, and so I get them to bed. This is how I did it last week when I took my questions. I got them to bed and I was like to my husband, okay, you got the kids. And I dug in and I started a question and just, felt out how the first one went. And the kids were still asleep. And so I kept going, and I probably did like 8 questions that first night. And I was like, and I'm tired. Close, save, and exit or whatever. And then I came back I think I did it over 4 nights, and you can do 1 per day. You can do all at one sitting. It's your choice.
One thing I do think that is we talked about this in our last webinar and helpful is most people found it helpful to have that quiet space. So whether they're like, take their laptop to a coffee shop where they don't have anyone at home, or they tell a spouse like, hey, everyone needs to leave me alone for an hour. I'm closing the door and no one call unless you're like on fire or like bleeding. But I think some people do them like during clinic day, like in the middle of lunch and stuff. But for me, I kind of like to be focused in my right chair. I like to have my second screen with the guide on, and I like to do them when I had some brain power time. So that may be really helpful just to like plan it on your schedule. Like 2 weeks from Thursday, I'm going to spend 7 to 9 and just knock these things out and get them done, and arrange for my house to be quiet, or I'm going to be out of my house, or whatever you want to do to make a place that's quiet for you. What other questions have we got here, Chelsey? Are you able to select how many questions you see per session? If that question is about the PANRE-LA, no, you just like you have 25, but you can answer as many as you want. You can once you click start, you have to answer that one, but you can answer just one and then go back. And then a question about storing, you only can store 5. So if you store 5 and then you want to store 6, they make you go answer one of the 5 you stored. You have to get those done by the end of the quarter. It's not like you can store them for multiple quarters. But the one thing that's good about storing is if you are like on a laptop or on a smaller device and they by chance give you like an EKG or an X-ray and you think like, ooh, I want to have a big screen when I see this X-ray or see this EKG so I can count boxes or I can zoom in or something. So if you want to store a question that comes with an image, you can do that. It will tell you if the item comes with an image. It will say, your next question is a Durham question. There is no image. Or it will say, there is a chart or there is a picture. It will tell you if you're going to get some like visual media into the question, so you know if you think you want to store that one.
You can also store them if you're like me and cardiology gives you palpitations. So I skipped them. I only got 2, but I was going through and I was like, oop, cardiology, nope, store, not doing that. So I saved my 2 cardiology for the very end when I had 2 left. And I just, was like, all right, we got this. So you can store 5. You cannot store 6. So if you go to store your 6th one, what happens, Katie? I've never done that.
I don't know. I never stored any because I got so nervous. I just all my 25.
Oh, yeah,
but the website will say you can only store 5. So I'm assuming they will say you can't store this and then click you back to your first stored question. That's what I assume. But again, I've never stored any, let alone 5.
Let's see. Someone asked about the QBank having an error message when they tried. I would say try it again. And if you still cannot access the QBank, message our support team at support@hippoeducation.com, and they can help you figure out what is going on with that.
We will put some links to the different question banks we have. So we have our big AAPA QBank, which has like 2,200 questions in it. That's with the one with our video course for folks taking the PANCE or the additional PANRE, or you want a bunch of CME. We also have those self-assessments, the general practice self-assessment, which is also another set of questions. And we'll put some links in the chat to that. So you can, if that's something you're interested in, or you can just go to our website at hippoeducation.com and then look at kind of what we offer in the PA realm for our questions. Okay, I confused some people when I talk about stored questions. So you can store a question. You don't have to answer right away. Once you open it, you have to answer. But like Chelsey said, she gets to the screen. Your next answer is cardiology. And Chelsey says, no, thank you. So Chelsey hits store, and then the question gets stored, and then say that was question 7. Then she gets the next question A. Your next question is endocrine. Okay, so Chelsey clicks it and she gets her 5 minutes and then she takes it. So she will finish her 23 questions, and then she'll have 2 stored questions that she has to finish by the end of the quarter to be complete, but she can put them on hold. So again, if she wanted to go brush up on cardiology, or is one that came with an image and she wanted to wait till she was home to a bigger computer or bigger screen, she could store that, but you can only store up to 5 questions.
Yeah, and it's not like skip forever. No, thank you. No. I never want this. It's like, just not today, unfortunately.
Yeah. I wish it was no, thank you. I never want that. No, thank you. I never want to answer that. Goodbye. No, it'd be awesome if we could pick that, but we can't.
Someone asked, if we offer practice questions with the reference guide subscription. We do not. But like Katie said, we have several other products, and there's question banks everywhere that you can find. You can also, I've never tried this, but apparently you can ask ChatGPT to write you medical questions to practice. I don't know. I'm not a ChatGPT guru, but that's a free option, I think. So we will send, after this webinar is over, we'll send like a post-webinar email out tomorrow, I think, and we'll have like links to some old blogs that we've written about PANRE-LA topics. We'll have the link to our old webinar, and we can, throw in a link or two for some of our question banks as well.
Let me answer one last question before we sign off. Someone said, can you store a question after you open it? No. The minute you hit open that question, that timer is set for 5 minutes, it's counting down, and you have to answer it. So you only can store or stop the exam before you open a question, but once you open it, 5 minutes. So.
Sorry, Charlie.
Yeah, sorry. Sorry. As we say in our house, sorry, Charlie, when it means you're actually not sorry, right? Sorry, Charlie. Thank you so much, everyone, for joining us. And we're glad you're here. We hope we answered some of your questions. We're all in this together. We're all learning about this PANRE-LA exam. I was the first group that took it. Now that I'm done with it, we learned a lot. We've learned a lot at Hippo about it. But any questions, concerns, worries, comments you have about the guide, or that we can try to help answer about the exam, we don't work for NCCPA, but we know a lot about it. Please let us know. Please reach out. And we hope that this helps you just be less anxious and get this test done faster, because this test is just the block in the road for us to continue taking care of patients and doing what we love to do by practicing medicine and being PA. So we hope that we help this process be as painless as it can, despite the small pain that it is in our life that we have to take it. Thanks a bunch. Appreciate everybody.
Thank you so much.